Hi, I'm Olivia Veatch, and I'm an assistant professor at the University of Kansas Medical Center in the United States. And I'm a human geneticist. I study how genetic changes in people with Prader-Willi syndrome may also affect sleep. And the hope is that this research will help us identify better ways to treat sleep problems in people who have Prader-Willi syndrome.
Hello, I am Althea Robinson Shelton. I am a medical doctor who practices sleep medicine at Vanderbilt University in Tennessee in the United States. In particular, I treat patients with neurodevelopmental disorders and sleep problems. I am the sleep neurologist in our Prader-Willi syndrome clinic, which is a multidisciplinary clinic at Vanderbilt University, and I'm excited to be here.
So as I said, I'm a human geneticist, and I study how genetic changes in people who have Prader-Willi syndrome might connect with the genetics of sleep. And the reason I do that is because there are a group of genes, very well-known group of genes, that make up something in our brain called the master clock. And this clock is what helps our bodies keep time, and it responds to cues from the environment like the sun, although there's not a whole lot of sun in Ireland right now, but it does. When there's sun, it does that. It helps tell us that when the sun is out, it's time to wake up, and when the sun is not out, it's time to fall asleep. But the master clock actually sits in a part of our brain called the hypothalamus. And the hypothalamus is something in some people with Prader-Willi syndrome, it doesn't work correctly. And so that could be why some people have issues falling asleep at night and staying awake during the day. There's also some genes that are deleted in people with Prader-Willi syndrome that help the clock run. And so since these genes aren't working appropriately, then the clock is not working appropriately. And so this could also be why some people have issues with daytime sleepiness, wanting to be asleep during the day, and wanting to be awake at night. And there are also some symptoms in Prader-Willi syndrome, like hypotonia and obesity, as well as facial features that can restrict the airway. And this makes it difficult to breathe during the night. And then when you can't breathe at night, you also have trouble sleeping. And ultimately, sleep is very important because we know that some of the reasons why we sleep are to help us develop healthy brains and healthy metabolisms. And so that's why it's very important that we find ways to treat sleep problems in people who have Prader-Willi syndrome. And so the work that we're doing is hopefully going to identify why different people with Prader-Willi syndrome have different types of sleep problems. And then if we know that, then we can find better ways to treat sleep problems in people who have Prader-Willi syndrome. And hopefully this will help us improve not just neurological function or the function of our metabolisms, but overall quality of life. And so now I'll send it to Dr. Shelton, who is going to talk about how she treats sleep problems in people who have Prader-Willi syndrome.
Individuals with Prader-Willi syndrome often report excessive daytime sleepiness. Another name for excessive daytime sleepiness is hypersomnia. Hypersomnia can be debilitating to individuals with PWS. For example, hypersomnia has been shown to increase challenging behaviors in children and adolescents with PWS. There are several sleep disorders that can lead to hypersomnia, but for this brief discussion, we will be focusing on sleep-disordered breathing and central hypersomnias, in particular narcolepsy. So the term sleep-disordered breathing really talks about disorders of breathing that occur primarily in sleep. The most common sleep disordered breathing disorder that's seen in patients with PWS is obstructive sleep apnea, but central sleep apnea can also be seen. So what is obstructive sleep apnea? Obstructive sleep apnea is partial or complete obstruction of the upper airway associated with at least one of these symptoms: sleep disruption, low oxygen in sleep, elevated carbon dioxide in sleep, and or daytime problems. So daytime problems such as an increase in challenging behaviors, excessive daytime sleepiness, but also learning problems such as regression in things that have already been learned, difficulties in making progress in therapies such as physical therapy, speech therapy, and occupational therapy. Central hypersomnia involves abnormalities in brain neurohormones that control our alertness. And so when there are deficiencies in these neurohormones, we experience excessive daytime sleepiness. The most common central hypersomnia is narcolepsy. A hallmark of narcolepsy is excessive daytime sleepiness. But another common symptom seen in narcolepsy is cataplexy. And cataplexy is a loss of muscle tone with strong emotion, but also with anticipation of reward. So, for instance, anticipating a meal or anticipating food. Isolated cataplexy is extremely rare, and PWS is one of the few disorders where you can have isolated cataplexy. So let's discuss obstructive sleep apnea a little bit more. The incidence of obstructive sleep apnea and Prader-Willi syndrome is much higher than in a neurotypical individual. In fact, it's been reported to be as high as 80%. In addition, the symptoms of obstructive sleep apnea can be much worse in patients and individuals with Prader-Willi syndrome. So, for example, they may have longer respiratory pauses, which then may lead to higher elevations in carbon dioxide and lower oxygen saturations in sleep. There are several guidelines in regards to sleep studies and growth hormone treatment, which is used in some countries to treat growth hormone deficiency commonly in patients with PWS. But because growth hormone treatment is not standard in all countries, I won't be discussing that today. However, the recommendation is that between the ages of 1 and 5, and again between the ages of 5 and 13, that individuals with PWS be screened for obstructive sleep apnea. If symptoms of obstructive sleep apnea are present, then a referral to a sleep specialist, if there's one in your area, should be made and a sleep study performed. If that sleep study shows obstructive sleep apnea, then it should be treated. The gold standard treatment for obstructive sleep apnea in children is adenotonsillectomy. Adenotonsillectomy means taking out the adenoids, which are right behind here, and the tonsils. Adenotonsillectomy has been shown to be effective and safe in patients with PWS. But other options to treat obstructive sleep apnea include positive airway pressure treatment, which is a machine that one would wear at night to help open up the airway and thus help the patient breathe effectively in sleep. And another vital component to treating obstructive sleep apnea is weight management. If you live in an area where there are not readily available sleep specialists or a sleep study is not a possibility, the most important thing that you can do as a caregiver for your loved one with PWS to treat and control and also maybe even prevent obstructive sleep apnea is weight management. So I've been treating patients with Prader-Willi and sleep disorders for over 11 years now. And what I find is that sleep is not often discussed. Sleep is often ignored. But sleep and treating underlying sleep disorders is such a vital component to improve their quality of life. So my advice is that we at least start the discussion and open up the discussion with our loved one's pediatrician, their general practitioner, about their sleep.